time?
No, I didn't know. No.
Okay, well, nice to meet you. I think everybody else was here. So same as last time, if you have questions throughout, you just go ahead and jump on. You can interrupt me all you want, okay?
Okay, thank you.
So I'll see if I can switch over here. So I don't know, Lisa, if you can maybe allow me to share. Oh, there we go. Got it.
Yep, you should be good to go. Let me know.
See if it'll let me. Can you all see that now, hopefully?
Can you guys see that on your end? Maybe give us a thumbs up if you can see it.
Yeah, that's good. You can see it better. Yeah.
Can you see that deliver rehab?
That's even better.
On there? Okay, perfect.
That's like full screen. Yep, that's good.
Okay. So I've given this talk a few times in the past. I looked around to see if there was any updated data, but it doesn't look like a lot's been done in the last year regarding falls. I think all the resources are pushed towards other stuff right now. So we'll just see, you know, if the numbers are updated in the future. I can always come back and do an updated number thing for you. But so we'll jump right in here. But basically today, this is kind of an informal discussion. If you have questions, hopefully get some interaction with you all. I'm going to try and connect, you know, this idea of optimal aging and falls and how do they connect. So, you know, optimal aging, we'll talk about that in a little bit. But, you know, thinking about, let's see, I think I can do a pointer here. Can you see that red dot on there? This is a little bit of a test. Okay, so that's my pointer. So, you know, thinking about optimal aging, you know, that's, you know, people that are riding bikes into their 80s, 90s, running around, you know, versus kind of a poor aging, you know, a lot of times that's tied in with falling. You know, you think of those are connected. So we're going to kind of dive into that and we'll just see the connections and how they are related to each other. Let's see here. So we'll go through a couple things, but first we'll talk a little bit about falls. You know, why should you care? And what I want you to take away from this, I'm going to try and frame this in a way that hopefully makes you think about falls in a new way, is that falling is, from my experience and the things that I see, falling is usually a symptom of something else going on. And we'll go through, you know, whether it's an environmental thing, if it's a medication thing, or if it's a physical thing like a balance or strength related issue. Most of the time, experiencing a fall is a symptom of something else going on. Most of the time, a fall is not just happen leading to other stuff. Usually there's something else going on before that. So that's what I want you to kind of think about as we go through stuff, is that, you know, falling is a symptom usually of something else. And then after we go through all that, we'll talk about optimal versus poor aging. Pretty straightforward, but we'll have some discussion on that. It's good to set some goals and, you know, kind of talk about that a little bit. And then lastly, do you have a plan? So we'll get into a little bit of goal planning type thing here too, all right? Can everybody hear me okay?
Yes.
Yes.
Okay. So falls. Falling is pretty common. How common is it? Does anybody know?
No.
I'm sure you've had some falling presentations before. So a lot of this information gets reused, but this is from 2014. Now, hopefully this gets updated soon, but 2014 in the US, there were 29 million falls. So lots of people falling, lots of injuries, 7 million injuries out of those 29 million falls. $31 billion in 2014 that cost to Medicare. So that number in 2014, I mean, you can guess that that number is going to be significantly higher today than it was then, just because the population is getting older, right? So big number. Every 11 seconds, there's an ER visit in 2014 related to a fall. So a lot of times if I'm going out to a senior apartment or an assisted living, there's an ambulance out front. Most of the time that's related to somebody falling. Has anybody noticed an ambulance out in front of a building before? Does anybody, it looks like you all maybe are in a house. So maybe you don't have that experience, but if you know somebody in a senior apartment, ask them how often the ambulances come to their apartment. And most of the time it's related to a fall. So very common, 1 out of 4 older Americans fall at some point. So 25%. I've had multiple falls this year, and I will admit that. most of the time on ice here. So big number here I want you to look at is, so 1 out of 4 older Americans fall, but however, less than half of them tell their doctor about it. So why do you think that people are not talking to their doctor or their medical provider? Why are they not telling them they're having falls? So if you have any ideas, go ahead and jump in here.
I know one. They're afraid that they're going to have to leave their home.
Yeah, so that's actually probably the number one thing that I hear. And I don't have there's no answers on this that are 100%, but just with talking with people, I think that's the biggest fear, is that once they open that can of worms, they can't go back, so they think that they're going to lose their independence and can't stay home. And that's actually not the case. Most of the time, that's a sign that you're motivated to stay home and you want to do everything you can to stay home. The one that I get a lot is that people just forget. So, you fall and then you go see your provider a month or two later and you don't remember that happened. So I encourage everybody to have a journal. So even if it's just a little notepad, put that right on your fridge. And if you have a fall, or if you have something like, if you almost fall, a near fall can count as a fall. So if you almost fall, but you catch yourself, I would write that down on a piece of paper. And then when you go into your doctor or your nurse practitioner for that annual appointment, you just say, hey, here's what's going on in my life. Can you help me go through this stuff? So I would encourage you to write down any medication questions, any other, health issues you're having, put it all down on paper, and then let that provider kind of sort through all that information. Does anybody not have a medical journal or something that they keep information on?
Oh, I keep one.
Yeah. I think most people do write down stuff, but I would just say, have a designated place where you put down absolutely everything related to your health. And then that way, it's just all in one spot. Like your medication lists as well, keep all that in there together. Elisa, does the senior center have like a medical journal handout type thing that you give out?
That is a really good question. I would need to ask our case managers, because we might have something like that. I know they have it's called File of Life, and it's like where they can keep all their medications in there, and it stays like on their fridge or something.
Yep.
I'll have to ask them about that. But the File of Life is the medication one.
Okay. I actually made, I think about a year and a half ago, I actually had some stuff printed, just like a folded book of a medical journal. So maybe I could get some of those reprinted and drop them off at some point too. But, just a simple notebook is good too.
That's a good idea, because most people think it's not that significant to mention to the doctor. However, when you go for a wellness visit, they ask you.
Yeah, I do. Yep. Yeah, that's a good point.
And sometimes you just forget. Sometimes you just forget too.
Yeah, so I would just encourage you to write down everything, and then if it is, if you're a very in-depth writer, then they might try and condense it down from there. But I've never met a medical provider that doesn't appreciate having stuff written down. Most of the time, it's just easier to sort through things then. So falls are the leading cause. Well, we'll keep moving on here. Of both fatal and non-fatal injuries among older adults. So big thing you hear about with falls are like hip fractures. Head trauma is another big one. Concussions. That's something that gets we hear about a lot. Head trauma, you fall down, and then a lot of times people fall down, they try and get up, and then they fall again. And a lot of times head injuries can happen from that too. So different things other than just death. A lot of hip fractures. The statistic here I thought was interesting. The number is big. It's 25,000 older adults died in 2013, but it died from unintentional falls. And I thought that was funny. Yeah, nobody intends to fall. So I think going back to that question about why do we not tell our medical provider about falls, and I think some of that is there's a kind of a shame to falling. You don't want to admit that you've had a fall because you're kind of ashamed of that. So just, something to remember that nobody intends to fall. It's not your fault. So I think that ties in there. I might be reaching on that, but that's what that tells me, I think. All right, falls in Wisconsin. So back in 2019, there was some big news articles that came out about falls in the U.S. and falls in Wisconsin. Does anybody remember that?
No.
made kind of the front page in all the papers. But basically, they did a big report for falls throughout the United States, and Wisconsin had some pretty big numbers. So 129,000 emergency room visits in 2017, lots of hospitalizations. All these are all related to falling. Over $1 billion for the state. But what was fascinating or unfortunate about Wisconsin was that we actually led the U.S. in deadly falls. So out of all the states, all 50 states, we actually led the U.S. in the amount of people that died from a fall. Does anybody remember that article or that research? No.
He did.
Yeah, so we actually were higher than twice the national average. So quite not just a little bit, but we were quite a bit higher than most states. An interesting stat here is that, well, let's pull that up here. Deaths from falls in Wisconsin at this time outnumbered deaths from breast and prostate cancer combined. So I mean, it's a huge deal in our state. And so they didn't really give any details about why we were the highest. I think that research will be coming at some point in the future. But does anybody have any ideas why we have the most deadly falls, I would say?
Icy conditions.
Yeah. Yep. I think that's part of it. Minnesota has icy conditions as well. So I don't know the right answer on that, but I think that's a big part of it, is that we do have that winter weather as well. Anybody else?
I've also heard we're more sedentary in the winter months in Wisconsin. We stay in more. Or people haven't been outside and then their driveways get full of ice and snow. They go out to shovel, and then they fall that way as well.
Yeah. Yep. Absolutely. Yeah. I think weather plays a big part in it. I do think we have, Wisconsin, we have more alcohol. It's a bigger part of our state. So I think that might be part of it. I know, Chuck, I see you were nodding there.
Well, I was wondering if maybe we're risk takers. We're more active outside in the summer doing things.
Yeah, that could be. Yeah. Yeah. Like I said, I don't have the answers for this, but I mean, that's a valid argument. Something else I've noticed too is that we have a lot of people that are living at home alone, and we do have some more rural areas. So it could be just that, we have more independent people later in life. We have a lot of staircases that go like this too at older homes.
What?
So, yeah, so all interesting stuff to talk about over coffee. That's, let me know what you come up with those. Anybody else on that? Okay. All right, so now we're going to shift in here. So, falls are very common. There's a lot of things that tie into what causes a fall. So it can come from many different things. It could be a combination. It could be a singular thing. But these 6 areas here, I'm going to try and break it down into like the 6 kind of hit list areas. So these are the ones that are most commonly related to falls. What causes them, or, what kind of increases that risk of a fall. So we're going to go through each of these different areas, okay? All right, home safety. So biggest thing is keep your pathway clear. Pretty straightforward, but try and keep the clutter clear, especially around the stairs, around doorways. You'd be surprised. I do work a lot. I go out to the home and work with people, and there's a lot of people where they have to sidestep to get into a bathroom or bedroom because just there's stuff in the way. So always trying to just make it as wide and as clear as possible, just to remove that risk of tripping on something. Something a lot of people don't think about is lighting. So if you're getting up at night to go to the bathroom, try and have a nightlight in the hallway, or have a flashlight or something handily available for you. So being in a dark environment removes the balance from your eyes. You don't get that balance from your eyes as much. So if you can light that pathway up, that's always a benefit. Oxygen lines. So if you use oxygen lines at night, or if you have like a CPAP or BiPAP, making sure that hose isn't going to get tangled up on you as you're getting out of bed. Another thing, I think, does anybody have any dogs or cats running around in the background? I don't see anything. But you know, if you have dogs or cats, just make sure you know where they are. They like to sleep at your feet, so you get up to go to the bathroom and trip on a cat or a dog. That happens quite a bit. So just some stuff to be aware of, and you know, these are all modifiable things. You can do your best to remove those risks overall to not, hopefully not experience a fall from a home safety standpoint. Anybody have any questions on this stuff? I think this gets talked about quite a bit. Yeah, okay. Weather. So we did mention that, yeah, we live in Wisconsin. That should not be a surprise to anybody. We're getting another snowstorm this weekend. I love it, but you know, that's just something you have to be ready for and have to be prepared for. So, you know, the biggest thing that I can say here is that make sure that your shoes are appropriate, your boots. So a lot of people have older shoes that the treads are all worn out. You know, it's the same thing on your car. When your car tires get worn out, you have to replace them with good treads. So they do make shoes that are have more friction on them, that can provide more stability. So take a look at your shoes. You might need to get new shoes if yours are getting worn out. Things to be careful of are those slopes and inclines if you're going outside. You know, especially now, you got to watch out for the ice, but you know, just make sure you're taking your time and shuffle your feet rather than taking those big steps. Try and shuffle your feet. Heavy items. If you're carrying heavy items like a purse, my grandma had a very large, heavy purse that she carried all the time on one side. So that can definitely throw off your balance towards that side. So, you know, might need to lessen that load or just be aware of that so that you know it. Try and counteract that. Another thing to watch out for too is if you're getting in and out of a vehicle, just be really careful that last kind of step. You do that little bit of a twist to get into your car. A lot of people fall getting into their car because you do a little bit of a twist to get in and your feet give out. So especially in the winter when it's slippery, or it could be, make sure you're turning all the way around. Grab the car, grab something that's not going to move, and then try and sit straight backwards. You know, so that you're sitting down rather than doing like a step turn into sit. Does that make sense? Yeah, so that's something to watch out for. Pretty straightforward with the weather. Eyes. So balance, falls, all that is related to the eyes, and I'll touch on why in a little bit here. But basically our eyes are they're a very large part of our balance and maintaining our stability when we're walking. So making sure that your glasses are up to date, making sure your prescriptions are up to date, that can have a huge impact on your balance, especially if you have a bifocal or even a trifocal. Does anybody have that? You don't have to mention it if you have. Yeah, you probably know somebody that does. You know, there's a line usually. A lot of people have a hard time on stairs with those just because it changes the magnification. So just being really careful with that, the vision, especially if you have those bifocals, trifocals. Things like cataracts, glaucoma affects your vision. So just making sure that you're up to date on any medications. And if you're still having issues with that, there are some things you can do to try and improve all your other balance systems just to counteract that as well, if you're having balance issues related to the eyes. Little tip here, do you have a backup pair of glasses? See a couple people that have glasses. Yeah, most people have their old set, but you know, if you can have a backup pair, because you don't want to be stuck without a pair of glasses, and then, you know, especially now with the virus, you don't want to have to be forced to go out and get a new pair in the middle of winter. So having a backup set of glasses is always a good thing if you can get it. All right. Medications. Can medications affect your balance and your, you know, having falls? Can that, what do you guys think?
Yeah.
Yeah, that's, yeah, pretty, yeah, a lot of medications out there. There's a lot of medications that actually can have pretty significant impacts on, you know, on your stability and causing things like falls. So the takeaway from these next two slides is, I'm not a pharmacist, I'm not a physician, but it's good to know what medications you're on and what are the side effects. So this would be something at your next appointment with your primary care, just, you know, go in with the list and say, hey, I want to know which of my medications can cause falls or increase my risk of having a fall. And some of them might be, well, when you take this medication, you have to be careful over the next half an hour because that can cause some dizziness episodes. So just knowing that stuff can be really powerful in that you can modify your behavior to lower that falls risk. Does that make sense?
Yes.
Yeah, so just knowing what medications you're on and what they do, I think that's all good stuff. But some of the common medications that can affect your balance, your falls risk, blood pressure drugs are the biggest one. That's what most people are on that hypertension drug. But anything like with the heart, that can cause episodes where you can get dizzy or have that orthostatic hypotension where you can kind of pass out if you stand up too quickly.
Yeah.
So then you might need to do things where you modify, where you say, all right, because I'm on this medication, this can cause me to pass out sometimes, hopefully not, but that it's a risk. So maybe you have to, instead of standing up right away, maybe you sit there for a minute or two, then stand up, make sure you get your bearings for a minute, and then you go. So that's something that a lot of people have to do just to modify, to hopefully lower that risk of falling from that. A lot of drugs on here that people don't think about related to balance or falls. If you're on diabetes drugs, a lot of people with diabetes have that peripheral neuropathy. Have you heard that one before?
Yeah.
Yeah, so like numbness in your feet. So yeah, if you're getting numbness, that's another thing, but that can definitely relate to falls. But if you're on diabetes drugs, that can be a risk factor. Pretty much any pain drug can cause increased risk of falls. Sleeping drugs, so that's one that not a lot of people think about, but if you're having trouble sleeping and you're taking some medications for that, it's good to have that talk with your medical provider about how does that relate to increased falls risk, because that is an increased falls risk just by being on those. Other things, antidepressant drugs, anti-anxiety, those are pretty common drugs. So lots of things that can cause issues. It's just good to have those discussions with your medical provider. Does anybody have any questions on the medications?
One thing I just want to mention that my doctor suggested to me is, and of course everybody would have to check with their doctor before they would do it, is I was taking some of these pills in the morning because that's traditional. He said, try taking these drugs at night, because then if it makes you dizzy, it's not going to impact you as much when you're sleeping, obviously. So
yeah, that's a really good point, Chuck. And I like that you said, talk to your medical provider before you do that. Little disclaimer there, before you change anything, make sure you talk to somebody who knows what they're doing, because it's not the same for everybody. But like something like that, that's a really good, having that discussion and asking about that stuff, there's a lot of modifications they can do to get around some of those risk factors. So really good point. Oh, go ahead, Barb. Can you unmute?
I think too. Oh, can you hear me or not?
Yep. Go ahead, Barb.
Okay. I think a lot of times people, older people, if you're over 50, you're allowed one visit to the bathroom at night for every decade you are over 50. So if you're 60, one time is typical. If you're 70, 2 times is typical. So you get up in the night to go to the bathroom, and a lot of people don't want to wake up all the way, so they don't turn lights on.
Right.
And the lighting isn't adequate because of these bathroom breaks they have to take. And a lot of them, I think, fall at night. And as long as they can get themselves to the bathroom and get themselves back in bed, they don't mention it to the doctor if they're not stiff or anything the next day. But maybe this is an issue that they need to address.
Yeah, that's actually a really good point. And I've never thought about that as, they don't want to wake themselves up fully because then it might be hard to fall asleep. So I've never thought about that before. That's a really good point. But yeah, just knowing that is something that maybe can be addressed and maybe modified, if they can adjust the dosage at the end of the day or, whatever to hopefully let you sleep longer. So yeah, that's a really good point. Did everybody hear Chuck and Barb?
Yeah. And also turn on the light. Sometimes
turn on the light. That's the easiest.
But if I one time bruised myself just not turning on the light,
Yeah, and you don't need a prescription to turn on the light, so you can go ahead and do that one, all right?
Okay, I have a question.
Yes, sir.
Wouldn't blood pressure medications have an effect?
Yep, absolutely. Yep. So that's actually the very first one on there. So yeah,
Oh,
blood
okay.
pressure drugs. That's kind of the main one that you see the most often causing issues.
Okay.
That's where a lot of people get that dizziness when they stand up. You know, positional changes, their blood pressure drops. So yeah,
That happens even if you're not on blood pressure. I
Yep.
have blood pressure and I don't have any medication, but I have to be careful when I get up to do it carefully. Or if I stoop when I get up, that's what I'm noticing.
yeah. Yeah, so you know, if you're having any of those issues, I'm assuming you've talked to your medical provider already on that, but you know, if that's an issue that you're having, I would for sure write that down. And you know, if it's something that's causing issues, even give your provider a call. Don't wait until next time you go in, you know. All right. Good
Yeah.
discussion. I appreciate your comments. That makes this a little bit more fun. All right. Something that there's also something that I think Medicare does, and if you have a different insurance, it might be different too. But a lot of insurances cover this comprehensive medical review, and I think a pharmacist can do some of that stuff. So has anybody ever met with a pharmacist? Yeah. So pharmacists, I think hopefully they're used more and more often here going forward. But I do think they're an underutilized provider. You know, if you can go sit down with somebody and just go over all your medications, that's really powerful. So it might be something to reach out. If you go to a pharmacy, reach out to them and see if they would sit down and go over stuff with you, even a virtual call. So that's pretty much there. Just make sure, yeah, if you don't know your medications, if you have questions, make sure you ask that stuff, because you know, if you're putting it in your body, you want to know what it does. Right. All right, something here, urinary issues. So things like urgency, frequency, you know, we kind of mentioned that a couple times, but you know, that's stuff that can be modified. You know, if it's a muscular issue, you know, it might be a medication thing you need to modify. Maybe it's a diet thing. So all different things that can tie into that. So, you know, if you're getting up at night and you're having to go to the bathroom more and more, like Barb said, I mean, the more you have to get up and go to the bathroom when you're tired, I think the more you're increasing your risk of having a fall. So if you're having issues like that, that is something that can be worked on. And that actually is something that physical therapy can do as well. You know, if you've ever met with, you don't have to raise your hands on this, but that is something that, you know, physical therapy can help with. That's outside my specialty area, but hopefully we have a PT named Lisa. She's actually trained in women's health areas, and she might be coming on soon to do some virtual stuff for that. So, but other than that, there are options out there. There are PTs that specialize in this, so you can always reach out to your doctor on that. All right, let's talk balance here. So I'm really condensing balance down into like a one slide format here. We could probably talk for a couple hours on what is balance and the different parts. So this is a very, very shortened version of it. So balance basically comes down to your eyes, what you see, your ears. So you get those vestibular systems in your ears. Has anybody heard of the ear as your balance? Yeah, a little bit. So we have these little devices in our ears that give us sense of movement, but then also what we feel. So that's, you know, through our skin, through our joints. So balance is it's a combination of all three of those. And then as we get older, that does change. We end up relying more on our eyes as we get older, but our eyes actually get worse as we get older. So then there's some issues there. But basically, it comes down to your eyes, your ears, and what you feel. All right. So we'll talk a little bit now about, you know, as we get older, what happens. But that is balance. So a lot of people, they ask me, you know, what can I do to help my balance? Well, it could be any of those three. So that's why I mentioned before, if you need your glasses updated, make sure you get them updated, because that could be number one. You might just need an updated prescription. But then if it's something for your vestibular system, or if you're having some sensation issues, those are things that you might need to work on through some exercise or some specific things.
Relative to the ears, can I just
Yep.
ask a quick question while you have
Sure.
this
Sure.
up on the screen?
Yep.
I actually have a couple of family members, my mother who is 91 and a brother who have who are going through some therapy for some ear crystals.
Yep.
Can you just kind of show me on your
Sure.
picture here where the ear crystals?
Yeah. Yep. So can you see my pointer
Yep.
there? Yeah. So a lot of times people will get these crystals that get into these canals right here.
Okay.
So it's called BPPV. So benign paraproximal positional vertigo. So you get these crystals in here, and basically what these canals do, they have these like little hair pieces of hair in there, and then as we turn left and right or up and down, fluid actually moves back and forth in those canals. So as you turn your head, you might you get some liquid that sloshes back and forth, and then that tells our brain that, hey, we're turning, we need to be prepared for that, or adjust to that. Well, what happens is sometimes you can get a tiny little crystal in here that kind of floats around, and as you turn your head, that crystal can kind of bounce around in there, and that really throws off your ability to tell where you are. So a lot of times you hear people say that, oh, every time I look up, I just start spinning. You probably hear that. Well, sometimes you get that crystal in there, so that crystal kind of bounces around and it sets off those motion sensors, so to speak. So that's actually a really a fun thing to work on with therapy, because we can actually do some specific exercises, hopefully to flush that crystal out. So, sometimes, you have to just go through there's a few specific exercises that you hopefully get that crystal out of there to reset the system.
What are some of the exercises? Like if you cross the street, sometimes you get a little bit dizzy, going back and forth, checking the traffic light and stuff. What specific exercises you have?
Well, so, and I get these questions all the time. So, it's tough to tell specifically what to work on, but, something like that, a lot of times that's related to, that could be related to your ability to adjust from moving targets to moving target with your eyes. So there are some exercises for that. It's tough to give specifics without, seeing what's going on, but tell you what, if you have questions on this stuff, even if you want to give me a call, that was Claire that asked that, right?
Yeah.
Yeah, I can give some general stuff, but a lot of that stuff you have to make sure I don't want to cause any damage by giving you something that's not appropriate for you.
On that a little bit anyway.
Okay, yeah. If you ever have issues with that type of stuff, talk to your medical provider on that, because there's some things that you can definitely do with that. If you have a PT you've worked with before, or if you need one, give me a call. But that's something you can definitely work on. All right. Is that helpful?
Yeah, thank you.
Okay. All right, let's talk about aging and what happens to the body as we get older. So
what is feel? When you say feel, how does that affect balance? What do you mean by that?
Sure. So we get feedback by pressure through our skin. So can you all see me? I don't know if you can see me or not.
Yeah.
You can. Okay. So if I squeeze my finger like that, I can feel that pressure.
Mm-hmm.
So as I'm walking, the pressure of the ground through my foot, I get pressure through my knee, through my hip. That gives my brain feedback of where I am. When I move my joints, I feel through those joints, through the skin, through the muscles, I'm getting feedback to my brain of what's happening. So that's all tied into figuring out where you are, what's happening to your body as you're moving around. You're constantly getting feedback to your brain based on all of your, the rest of your body. Does that help?
Yeah. Yeah.
Yeah, we could do a full presentation on just these three things. We could do a full presentation on each one of these things. So that might be something, I don't know if Elisa is still on, but that might be something we can come back in the future and do a little bit more in depth on these three.
Or exercise.
Balance, eyes, ears, feel. Got it.
Yep.
Specific exercises to prevent falling would be good.
Sure. Yep. Yep. So we can, we can kind of give you an exercise in each one. I mean, the easiest thing, and I can give you this one for the eyes. So, something about your eyes is you have to have the ability to focus on something. So something that everybody should be able to do is when you're sitting still, if you're sitting down safely, if you look at your thumb, you should be able to do a little bit of a head turn and focus on that thumb. So that's our brain's ability to do that. Is we have that from a very, very young age. So that's called your vestibular ocular reflex. So something like that, that's a really basic exercise, but being able to do that, that can help with, as you're moving around, if you're getting dizzy looking around, that could be coming from something like that. So yeah, we can come back to that one in the future, Elisa, if you're up for it. All right, I think we're gonna move on here. So what happens to the body as we get older? Now I can send over, I have like a little summary of all this stuff. If anybody wants this, if you don't want to take notes on this stuff, I can send that to Elisa and she can hand that out if you want that. So we're going to talk about, as we get older, as we age, there are some things that happen to our bodies that are directly tied into increasing your risk of falls. So remember I said before that falling usually is a symptom of something going on. Well, a lot of these things here could be things that are going on that could be related to falling. As we age, there's some normal things that happen that can contribute to falling, so I should say. The first one is cardiorespiratory, all right? So our lungs and our heart. So our aerobic capacity goes down as we get older, typically. So our ability to take oxygen and pump it throughout the body, the heart's ability to pump blood throughout the body, that generally decreases as we get older. Pulmonary function, our lungs don't bounce back as quickly, so it's harder to get that air in and out of our lungs. Typically happens as we get older. Muscular strength and endurance, well, force generating capacity. Typically our muscles, if you take the same part of a muscle from a 20-year-old and the same muscle from an 80-year-old, that 20-year-old muscle, that single muscle strand is going to be able to give more force than the older strand. Does that make sense?
Yeah.
So not talking about the size there, but just the ability to generate force. That's also tied into reaction time. So our reaction time as we get older tends to get a little bit slower, and that's tied into muscle strength, amongst other things as well. But that's why staying as strong as you can, lifting weights is really important as we get older. If you haven't done any weightlifting, I would highly encourage you to get involved with that, because that does help with maintaining that reaction time. So does anybody know how fast you have to react to avoid a fall? Excuse me. So to make your body has to react in, I think it's 0.6 seconds. So it's less than a second. Your body has to react, and that's an automatic reaction too. So you have to train your body to react to that, and then as you get older, you have to really focus on staying as active and as strong as you can to maintain that reaction time.
That's amazing.
Flexibility. Joints get more stiff as we get older. Does that surprise anybody?
No.
I'm getting to the age where we have a storm coming in this weekend. My knees are getting a little stiff. So it's a real thing. I think our joints they're not as flexible as we get older, and that's a normal thing to happen. Doesn't have to be that way, but it's normal. Our muscle tissue is actually less flexible. So we're less flexible, not just in the joints, but actually in our tissues. So it doesn't give as much. Body composition changes. When I've done this presentation in the past, I always bring donuts for the presentation. So there's some irony. There's some irony in that when I bring them. But basically, as we get older, our bones are less dense, especially if you're a woman over the age of 50, unfortunately. But the bones are a little bit weaker. You have less muscle mass overall. And then if you've heard that medical term before, sarcopenia, that's related to muscle mass. You might hear that one every now and then. So we have less muscle, less bone. So there's more fat in our bodies usually then too. So the fat ratio goes up. All right.
On the bone demineralization,
Yeah.
what can supplements like taking calcium pills, can those help or?
Yeah, and I'm going to defer that stuff to your primary care provider. Most of the time people are on calcium supplements. A lot of that stuff, exercise,
Right.
what I can say is, making sure that you're, stressing your muscles to keep those bones strong. That's something that definitely helps is, doing that consistent exercise that can maintain that bone strength.
Okay.
Especially weight training. So, using resistance training, that does help with keeping the bone strong. But yeah, diet's definitely a big part of it.
Okay.
If you're drinking 10 Cokes a day, you probably should swap that out. Yeah. All right. So all this stuff is bad, right? So, all I'm going to go back here. So, cardiorespiratory, our strength, flexibility, our body composition, those are all kind of negative things, right? Can you stop that, or is that the way it's going to be? That's the question, right? This is stuff that is normal with aging. This is going to happen at some point. All of this stuff is related to falling in some form, right? Is this going to happen no matter what? Well, actually, the research shows that if you're participating in exercise and physical activity, it can attenuate or delay. So it can kind of modify how impactful those changes are. So there's a definite effect on exercising, staying physically active, and slowing down a lot of those changes. That should be good news for everybody, right? Did everybody understand that?
Yep.
So at what age, here's the question, at what age is it too late?
It's never too late.
It's never too late, yeah, yep. So it's never too late to start with something. If you've never been a weightlifter or you've never been into exercise, anything you do is going to be better than what you haven't been doing. So even if it's, going for a 5-minute walk one day, if you haven't been walking, trying to get up to 5 or 10 minutes a day of walking, huge. That's cardiovascular for you. So everybody's at a different level. Anybody can set a goal to start something, and it's never too late, and it's going to have a positive impact. So I think I jumped a slide here, but basically that's, what I just said there. Aging itself does not cause falls, and falls, for the most part can be preventable. Now you might get a St. Bernard dog that runs up and jumps on your back and you don't know about it. That could happen, right? But there's a lot of stuff that can be preventable. So I talked about the home environment, making sure that you're not going to trip on something in your house. That's number one. Making sure your glasses are up to date. Staying on top of your medications. You don't want to take 2 of your heart medications on accident because you don't have them set up right. So trying to cut all those things out that can increase your risk of falling. And then on top of that, staying as physically active as you can, because your balance, your ability to not fall, a lot of that is related to your physical ability to do whatever you need to do in your daily life. And a lot of that comes back to exercise or just being active. All right, so that, I think I kind of went through all of them there. Yeah, weather, yeah. Being careful with the weather, that's the big one there. But does that make sense to everybody?
All right.
Sure does.
Yep. All right, so here's a couple of things. Never too old to exercise. Now, there's a lot of different recommendations on appropriate exercise. So, if you're not somebody that does exercise regularly and you want to start, way to go, but you should probably talk to a medical provider first. Because if you have a heart or lung issue, your exercise might look different than somebody who's been playing basketball their entire life. Is still running up and down the court. It's just going to be different, but in general, if you can get 30 minutes of moderate activity at least 3 days a week. So what does moderate activity look like? Anybody have any ideas?
You can carry on a conversation while you're walking.
Yeah, well, actually, that's a good point. Yep. So a that's called the walk and talk test. So if you're not able to talk while you're walking, that means you might be getting into a vigorous exercise. So moderate activity means it should be somewhat challenging. It's not easy, it's not difficult, it's medium, right? So if you want to make sure that you're not doing too much, being able to talk is actually a really good way to monitor that. So that's a good point, Claire. Moderate activity looks different for different people. Vacuuming is a moderate activity for a lot of people. Grocery shopping is a moderate activity for a lot of people. Other people, it might be you need to get outside and you need to do a power walk for a half an hour up and down the hills down on campus. That might be something else for them. Another thing in here too is try and do muscle strengthening 2 days a week. So that would be something a little bit more like focused on, physical exercise, getting some kind of weights or getting some soup cans or, something where you're doing something to challenge those muscles. That's going to be good for you. For a lot of different things. Has anybody done an exercise class at the senior center?
Yeah, nice. Yeah.
Yeah. So, that would be making sure you're, doing some kind of class twice a week. That you'll probably get some muscle strengthening in there. Right.
And those classes are free right now, people. They don't cost
There you go.
anything. And we have a YouTube channel. It's got them all on there too.
No excuses. Good. Okay. All right. Does anybody have any questions on, kind of exercise, aging?
Where does gardening come in? Is that a moderate activity?
Ooh, how tough is it for you?
Depends upon whether I'm hoeing or weeding.
Good. So yeah, so I think you kind of answered it there, right? So, if you're doing hoeing for half an hour, you're probably going to be sweating and breathing a little bit, right? That's probably somewhat tough. So I would consider that a moderate activity for most people. If you're bending down or, kind of getting low and pulling weeds, that could be a moderate activity. So it all comes down to, is it something that's outside of your normal routine and is it somewhat challenging for you? Then yeah, I would count that as an exercise. Yeah. Good question.
If you fall, what's the best way of getting up?
Ooh, that's a good question. So go ahead.
No, that's what I was wondering. Because if you fall, I fall and I've gotten up by just sort of holding the floor and getting near to something, and but I don't know what's the best way of getting up, and then what's the best way to prevent a fall when you're walking and you sense you're almost going to fall.
Can you repeat that last part?
If you sense you're almost going to fall, how do you prevent yourself from falling? Or if you're going to fall, do you want to fall on? You don't want to fall on your face. You'll injure your nose, your glasses, your eyes. What's the best way if you're going to try to prevent a fall, assuming one can be aware that they're almost going to fall? You sense yourself losing balance.
Yeah. Yeah, so those might be tough to give a specific answer, but if you feel like you're going to fall, if you're able to get to a spot to sit down, that's what I would say. But is it something that you're doing that consistently makes you feel like you're going to fall? So like
it's just with the ice or something. Sometimes I've not fallen, but that's another story. But I've also slipped almost. Almost fallen. I've had a few falls.
Yeah, and that's that type of stuff. If you're looking for a real specific answer, it's tough to give a general answer if it's kind of a specific thing. So I would always talk to your primary care provider about it, and then see if they can get you hooked up with some therapy for that.
And my husband fell in the house, but I told him we got to get a chair next to him so he could get up. you know?
Yeah. Yeah. So, getting up from the ground, that is something I work on with people. The biggest thing I say is when you fall down, if you're hurt, do not try and get up. So that's the most important part. Yeah. If you're hurt and you try and get up, that could be
You could
making
get
things worse. So, um,
getting older, you don't have the strength. If I'm on the floor, it's hard for me to get up. I have to sort of turn around, touch the floor, look for
yeah.
something. Younger, it's no problem.
Yeah. So I guess the other thing I would say for if you're having a hard time getting up from the floor is if you need help, a lot of people have those buttons on the life alert buttons. You know what I'm talking about?
Right, yeah, I've heard.
Or if you have like an Alexa, I might set somebody's off right now. If you have an Alexa, like if you have one of those Amazon speakers or Google speakers, you can all use those to call emergency services. And I know a lot of people are, if they fall and they can't get up, they don't use those services because I think they don't want to admit that they need help. But I would say if you fall and you can't get up, you should probably call somebody to help you because there's a risk of you falling as you're trying to get up, you can fall again. That does happen quite a bit.
He needed a chair next to him.
Yeah. Yeah. So good questions, but I think I will defer to that might be more of a specific thing for another time. Okay.
Oh, okay, sure.
I can.
All right. So we're going to talk a little bit here. We'll try and close it up here, but optimal aging, falls, thinking about that, what does optimal aging mean to you? Do you guys have any ideas on what that means? It's kind of a general. Yeah, go ahead, Barb.
I think it's an understanding, like you were talking about, keeping that journal of your
Yeah.
body and the things that change as time goes by, and being aware of where you're at. Like getting up on the ladder and changing that light bulb might have been cool when you're 50, but when you're 70, not so much. Ask somebody else to do it for you. And
Yeah.
I think just staying aware of what you're capable of doing without injury and admitting that I need more help now than I did when I was 50.
Yeah. Yeah, that's a really good point. I don't think I've heard that before from somebody, but yeah, having that understanding to ask for help, awareness of where you're at. And that's another thing too, is that, if you need help, ask for help. There's no shame in asking people for help. So yeah, good point there. Anybody else?
I think optimal aging is being the best, like 70-year-old or whatever age you are, by doing exercise,
Yep.
30 minutes, 3 times a week, doing strength too, developing your mind, keep on learning, things like that. To be the best, to reach you're the best you can be for your age. Because
Yeah.
Just remember.
Anybody else? Yeah, I think optimal aging, I've got a couple bullet points that I put down here, but this really, it's very specific to who you are. So, Barb's optimal aging is not the same as Chuck's optimal aging. I don't know both of you, but it's whatever you want it to be. You get to pick. You say you have to look out, 5 years from now, 10 years from now. What do I want to be doing in 5 years or 10 years? And how do I make that happen? A lot of times it comes back to, for this discussion, we have to do everything we can to keep ourselves from falling. Because, having falls, like I said, is a symptom. So there's other stuff going on, but if we can do everything we can to drop those falls down, that usually means we're covering all those bases underneath. Does that make sense?
Right.
Yeah. So you have to define it. You have to write it down, say, hey, this is what I want to be in 15 years, 20 years, this is what I want to be doing. So I'll go through a couple of things here and that might help clarify that. So the biggest thing I think about with optimal aging is that you're maintaining your independence, right? So that looks different for everybody. So, for somebody that might mean I'm going to be independent with making my meals every day, but I'm still going to be able to shower with somebody helping me. That's optimal for you. Great. It might be living on your own. It might be living at an assisted living. It just depends on where you're at. And you can always, set a good goal and maintain. And that's a good goal to maintain. Maintaining social activities. This is really tough right now, but I'm glad to see all of you are on Zoom calls. But hopefully that's going to change, sometime soon. But somebody who's aging optimally is engaged with social activities or doing stuff that they enjoy doing, rather than just kind of getting by day to day. So having something fun to do, challenging your brain, like Claire said, doing some stuff that's a little bit more fun for you. Yeah, optimal aging, health, being healthy, kind of synonymous here. On the other side of that, what does poor aging mean to you? Anybody have any ideas? Yeah, so poor aging within this framework, people that might be falling, you might have some stuff going on that ties into that poor aging, health issues. But the biggest thing here, it's the opposite of the independence. You might be more dependent on other people, and that's not a bad thing. Like I said, if you need help, it's good to ask for help. But that dependence on others, usually that's a sign that some other stuff is going on as well. Disability is kind of in there, and frailty. So those are all things that kind of get lumped into there. But hopefully having falls doesn't mean that you need help from other people or you're not dependent on other people. Yeah, we'll kind of go there. I think I have a picture here. Some things to kind of walk away from, and I do have these written down on that sheet that I can send to Alisa if you want to kind of print that out and fill it out. But some questions to leave here, as you walk away. Think about if you could do differently or improve on in the next 6 to 12 months, what would you do? Think about all that stuff we talked about or anything else that is not on that list. Some things that you want to change to lower your falls risks or things that get a little bit more healthy. What would you like to do in the next 6 or 12 months? And then I would stretch it out and say the next 5 years, the next 15 years. So plan that out, write that down, say, I want to be able to carry my grandchildren in the next 10 years, or beat them at euchre, who knows, being able to work your hands. So get really specific about that stuff, because that's good. Those are good things to put on your fridge and be able to look back to when, there's days when you don't want to get up and do anything. Don't want to go to the Verona Senior Center and do your exercise class. Well, you're doing that so that in 5 years you can still live independently, right? All right. All right, so I think we covered all that stuff. That was a good discussion from you all. But last thing I'm gonna leave you off with here too is that, a lot of these things that we talked about, a lot of the different changes, the things that can increase your falls risk, I want you to think about all that different stuff. Those are all kind of like signals going off in your dashboard on your car. So by themselves, they might not make a huge impact, but if you ignore them, they can lead to other issues. So hopefully you go forward from this, write stuff down, have those discussions with your medical providers, and just go forward looking at your medical provider is on your team. They're there to help you. So if you come with these specific issues you want to address, that's always a good thing. That's never going to be not a good thing. All right. The other thing I wanted to point out too here on this, the CDC has got a ton of really good stuff on falling. So there's a lot of good like handouts. There's some good questionnaires that you can go through and fill out. So I can try and forward that to Alisa too, but I'll see if I can show you. Can you see this page with the gentleman and the lady here? Okay. Yeah, so this is the link there. There's a whole bunch of stuff here. So like checking your risk for falling. Have you had a fall in the last year? Do you steady yourself by holding on to furniture? So like all that stuff, a lot of the things we've talked about, you can add those up and you can get a little bit of a number of, how at risk of a fall you are. So these type of resources are out there. They're not always 100% accurate, but it's good it'll highlight some of those signals that might be going off on your dashboard that you can work on, so to speak. All right. I think that's all I got. Does anybody have any questions?
That would be good if you could give us a journal, like that's a very good idea to have a medical journal so people.
Sure. Yep. Yeah, I'll see if I can get some more of those printed. They weren't too fancy, but like I said, you know, you get yourself just a notebook and that's keep everything in that area.
Great idea.
And then anytime you go to an appointment, I would take that with
Clicked on.
handouts at those appointments usually. But if you can